Medical doctor training is a rigorous and demanding process that requires a deep understanding of the human body, its functions, and the various diseases that can affect it. Medical doctors, also known as physicians, are responsible for diagnosing and treating patients, and their training is critical to ensuring that they possess the necessary skills and knowledge to provide high-quality patient care. In recent years, the medical education landscape has undergone significant changes, driven by advances in technology, changes in healthcare delivery, and an increasing focus on patient-centered care. One area that has received particular attention is the importance of fast inference in medical doctor training. Fast inference refers to the ability to quickly and accurately diagnose a patient's condition based on limited information. This involves using a combination of clinical knowledge, experience, and critical thinking skills to identify the most likely diagnosis and develop an effective treatment plan. Fast inference is critical in medical doctor training because it allows physicians to make timely and informed decisions about patient care. In emergency situations, where every minute counts, fast inference can be the difference between life and death. Even in non-emergency situations, fast inference can help physicians to identify and treat conditions early, reducing the risk of complications and improving patient outcomes. There are several reasons why fast inference is essential in medical doctor training. For one, time-sensitive decision-making is critical in emergency situations, where every minute counts. Physicians must be able to quickly diagnose and treat patients to prevent serious harm or death. Additionally, in many cases, physicians have limited information about a patient's condition, making it necessary to rely on their clinical knowledge and experience to make an accurate diagnosis. Medical conditions can also be complex and multifaceted, requiring physicians to consider multiple factors and possibilities when making a diagnosis. Finally, fast inference is critical to ensuring patient safety, as it allows physicians to identify and address potential complications and risks quickly. Teaching fast inference to medical students and residents is a challenging task, as it requires a combination of clinical knowledge, critical thinking skills, and experience. One of the challenges is that medical students and residents may not have sufficient exposure to complex cases, making it difficult for them to develop the skills and confidence they need to make accurate diagnoses. Another challenge is the lack of standardized training programs for teaching fast inference, making it difficult to ensure that all medical students and residents receive the same level of training. Assessing a physician's competence in fast inference can also be challenging, as it requires a combination of observation, feedback, and evaluation. Finally, fast inference is a skill that requires ongoing training and practice, as physicians must stay up to date with the latest medical knowledge and technologies. Despite these challenges, there are several strategies that can be used to teach fast inference to medical students and residents. One approach is case-based learning, which involves presenting students with real-life scenarios and asking them to diagnose and treat the patient. This approach allows students to develop their critical thinking skills and learn to apply their knowledge in a practical setting. Simulation training is another effective approach, which involves using mannequins or virtual reality to simulate real-life scenarios, allowing students to practice their skills in a safe and controlled environment. Mentorship is also an important component of teaching fast inference, as it involves pairing students with experienced physicians who can provide guidance and feedback on their performance. Finally, providing students with feedback and evaluation is critical to teaching fast inference, as it allows them to identify areas for improvement and develop their skills over time. Technology is also playing an increasingly important role in teaching fast inference, with several tools and resources available to support medical education. Artificial intelligence, for example, can be used to simulate real-life scenarios, provide feedback and evaluation, and help students to develop their critical thinking skills. Virtual reality can also be used to simulate real-life scenarios, allowing students to practice their skills in a safe and controlled environment. Online learning platforms can provide students with access to a wide range of educational resources, including case studies, videos, and interactive simulations. Finally, mobile apps can provide students with access to educational resources, such as medical calculators and diagnostic tools, on the go. By combining these strategies and technologies, medical educators can help to ensure that future physicians possess the skills and knowledge they need to provide high-quality patient care. Fast inference is a critical skill for medical doctors, and teaching it effectively requires a combination of clinical knowledge, critical thinking skills, and experience. Through providing students with the training and resources they need to develop their skills in fast inference, medical educators can help to ensure that future physicians are equipped to provide the best possible care for their patients.